Thank you for tuning into the Wise Healthcare Podcast. This podcast is intended for informational purposes only and should not be considered professional medical or healthcare advice. The views and opinions expressed by host and guests are their own and do not necessarily reflect the official stance of the ICF. Listeners are encouraged to seek professional guidance or conduct their own research before making any decisions related to healthcare or disability services. Wise Healthcare is not liable for any actions taken based on the information shared in this podcast. By listening, you agree to these terms.
He's an auditor now, but he's a man of many talents. So, Bernard.
Thank you and good evening. Thank you so much for coming along tonight to hear what we've got to say. The picture is okay, but I guess what sits behind it is more important. I started off life pushing trolleys around a Sydney public hospital till I decided that probably wasn't the best thing to do for the next 50 years. So I went and studied nursing. I did general nursing, then I did mental health nursing, and then I worked as a community mental health nurse. And that's the day I graduated, when I went into the community, because my first client was actually a guy I went to school with who was my tennis partner, who developed chronic schizophrenia from multiple drug abuse. This was in about 1983. I hadn't seen him for 15 years. And his mum said to me something that's really driven my whole career. She said, "Bernard, are you going to become part of the solution or be a continuation of the problem?" And from that day on, I thought if we're going to be in this field, one wants to be helpful. And I think as NDIS providers, it puts us in a really good place to help people in a productive and positive way. I now work with providers, hopefully in that same productive and positive way. Along the way, before I became a consultant, I was a CEO of hospitals, private and public. For 17 years, I was the co-director of what was initially a small NDIS business. Well, it wasn't even NDIS. It was a community services business on the upper North Shore of Sydney. When we bought it, it was turning over 2.2 million a year. I thought, this is my pension job. I'm set for life. Didn't realise there were so many changes going to take place. I think at one stage I had $10 left in the bank because my business partner's wife was squandering the money we were making in a really spectacular fashion. When we sold the business, it was turning over $27 million a year with outlets from Canberra through to Townsville. The people who bought it off us actually have turned the $27 million into 10. They made myself and our whole management team redundant, and of course out goes the Brains Trust. So what did I learn from all this? And I think this is the lesson I try and talk with people I have the privilege to work with. NDIS is a really tough gig, and I see a lot of heads around the room saying, yes, it is. If it was easy and simple, everyone would do it, there'd be no one closing their doors. What are the keys to success? And one can't encapsulate it within a couple of sentences, but I think if you think about that picture that Bobby had of the three wise monkeys, hear no evil, see no evil, do no evil. If you translate that into the quality world, the compliance world, there was a quality writer, a guy called W. Edwards Deming, one of the most irascible Americans I think I've ever met in my life. But he was the guy who restructured Japanese business at the end of World War II. Deming had an expression: if you do what you've always done, you'll have what you always had. So the constant challenge is to look at what we do and how do we do it. How do we improve our businesses? People now tell me, because I'm very old and grey and almost senile, they say that you do everything from behind your desk, you do everything on email, you don't go and see people. I spent 15 years knocking on doors. I was a bit like Willie Loman in Death of a Salesman. What's in the bag? Brochures. You knock on people, you meet people, you form the relationships, because this is the human services business, with as much emphasis on the human as the services. And if you build those relationships, you show the families that you're there to be part of the solution. You work with the families, because there's nobody more influential than the families. If they think you and your service are okay, you've been honest, transparent, do the best you can, put your hand up if you get something wrong, get abused and then move on and try and fix it, that's how you keep the clients. I had some clients for 15 years. All of our clients, the high value clients, because we had 24-hour-a-day forensic people, the whole works, we developed a niche. Bobby talked about the core type clients. Because I came from a mental health background, I wanted the most difficult clients. And unfortunately, we got them. And it really hones your skill. But if you try, whatever you specialise in, make sure you're the best on the block. Not the best ever, but the best that person can get. And that's where you really inculcate yourself with them. So many providers that I've worked with, both in the compliance world as well as the business world, never want to admit they made a mistake. I'm a male, I'm a nurse, of course I make mistakes. And I used to be quite happy to admit it. How many times did I get sued? Not once. Because if you admit that you got something wrong to people and ask them, what can I do to fix it, they're more likely to be very tolerant to you because they see you as working alongside them. So, in a nutshell, that's what I learned in my years in the business. That it's a slow grind every day, that it doesn't matter how flashy your marketing material is, if your actions don't match it, then all it is a really flash brochure. As a consultant, that's what I try and do also. Because after I got made redundant on my 65th birthday, I know you think this guy's 35, but thank you. I got made redundant on my 65th birthday, and I thought, I'm going to retire. I had enough money, I'll retire. That lasted for 24 hours. And a few of my friends rang me up and said, why don't we do some of this auditing business? Who here's had an audit? Who likes audits? Man, you get the lucky door prize. What we do in our consultancy is try and prepare people for an audit. Not so it's scaling Mount Kilimanjaro, but so their business grows along with it. Because auditing and compliance is a really interesting thing. That everybody wants to get through, and there are some auditing companies who categorically promise you'll get through if you go with them. Can I tell you? Bullshit. Tell them to go away. Thanks for coming, go away. There is no guarantee any consultant will get you through an audit. A good consultant will guarantee you that you'll be well prepared for the audit. And if they can guarantee you that, and that you feel comfortable working with them, and that might start an ongoing relationship, then that's a really good use of a consultant. So why would you engage a consultant? The NDIS can be a minefield for people, particularly when they're starting up, sometimes choosing even the right registration groups to apply for becomes difficult. I've done audits, and I've done over 500 NDIS audits, and I've gone along to new providers, no participants, no staff, but lots of hope, and they've got every module that the NDIS is enabling to have, which is core module through to module 5. When they've registered, they don't even know what they're registering for, because the NDIS don't give all that clear a guideline. So one of the things you might think about engaging a consultant for is to help you through that initial registration, the audit process, and preparing you for audit. You'll do as well as well at audit as you've prepared. Again, having done so many of these, I've turned up to people and they've said, tell me about your view on participants' rights. Seems a reasonable place to start. The response is, I've got the policies. And I said, that's great, but tell me what they mean. I've got the policies. So it's about understanding, and you would get your consultant to work with you to link the policies to the standards and then help you build an understanding of what it is. Because just having the policies means you've got a good sized door stopper. It doesn't mean you actually understand them. What can you expect from a consultant? What you can expect is that they'll work with you. Always remember, you're the customer. You're paying good money for this person to come along and work with you. You tell them what you need. If the first comment a potential consultant makes to you is, this is what I can do for you, send them in the same direction as the audit company who guarantees that you're going to get through. It's about how do you work with that consultant, what do you want from them, and how can they deliver that to you. What can't a consultant deliver? Quite a few things actually, but again, you get the consultants who will say to you, and I've unfortunately experienced this, every time I get a client ready for the NDIS, they get through because I've got a special relationship with such and such an auditing body. Now, I can't afford the defamation if I name the company that does it. However, let me tell you that people do say that. However, the final decision on whether a company is audited or is a registered provider or not rests with the NDIS. At the end of the audit, the auditor and the auditing body makes a recommendation to the Commission. The Commission can still challenge that recommendation. So nobody can guarantee that you'll get through. If you also get a consultant who doesn't want to train you, some consultants are really good at telling you what you need to know and then don't help you to understand what you need to know. Waste of your time and money. I was engaged by somebody very, very late in their audit preparation process to help them, and they'd engaged a very, very expensive consultancy firm. Very nice rooms they had in the city, and I was interviewed as part of the preparation, and the person who was interviewing me, I naively asked, so you've worked in the industry? No. You've been through NDIS audits? No. So how can you help me? Well, I know what they're going to ask you. That's not what it's about. It's about helping you to understand and be comfortable with it. So how would you choose a consultant? Well, you phone me, but if you don't, there are other really good ways of doing it. If you're thinking of engaging a consultant, ask them about their industry background. If they haven't worked in the industry, had their hands dirty at the level of supporting participants working in the NDIS, then I'd suggest to you keep working down the Google Drive or the Yellow Pages if people still use those. So it's about bringing a knowledge to it, because if you employ a consultant, what are you buying from them? Their knowledge, their experience. And the only way you really understand this business of the NDIS is getting in there, getting your hands dirty and working on it. How much should I pay a consultant? Really vexed question. I've been called in by clients. They've paid someone $20,000 to get them ready for audit, and it didn't work. Always avoid somebody who wants to give you a fixed price, because you don't actually know what you're getting. Work out what you need, tell them, and then ask them what their hourly rate is. My own belief is anything from $190 to about $250 an hour for an experienced industry-based consultant is a reasonable fee, but don't pay a bulk upfront. Make them work for their money, and you pay them when they've done certain amounts of work. Ask them how they're going to deliver the product to you. And the product should be essentially filling in the gaps of your knowledge until you feel comfortable with it. Because at the end of the day, you're the one who needs to be comfortable. You're the one who needs to feel that you understand it. And it's not just that ground level understanding, but when you're working with a consultant, ask them any and all questions that come into your mind. Again, my firm belief is there's no such thing as a silly question, and therefore, if it's important to you, you ask the consultant to help you understand it. If you purchase policies and procedures, ensure that they train you. Again, some people, some consultants will give you a lovely big doorstopper and tell you to read them. My 5-year-old granddaughter can read quite proficiently, doesn't mean she understands it. You have very busy lives trying to run businesses. You probably don't have time to read the 120 odd policies that really go around the core module. So you get them to work with you so that you understand it in a language you're comfortable with and how you apply it to your business. And personalise the policies. If they give them to you in PDFs, which I know some people do, tell them you want the word. Why? You've paid for it. They're yours. So you modify it to meet your needs. Big question, and that's what I learned when I was assisting my colleague. I said to this young lady, delightful young lady, she must have been 25, I guess, how many audits have you been involved in? Oh, that's not my department. And it probably is not. However, if you're a consultant training people to be prepared for audit, you should have at least been through the ringer once or twice yourself. When I owned the business over the 15 years, I think I had 27 or 28 audits from ACUS to ISO to NDIS to HSQF, because we did a lot of child safety in Queensland. You're almost audited out by the time you retire. Well, not a bad idea either. And remember again, please, this is a big issue to me. Remember that you're the customer. You tell them what you want. Because when you're working with your customers, they'll tell you what they want. So you have every right and responsibility to tell your consultant what they want, what you want, and if they can't deliver, there's plenty more of us out there to work with. As well as doing consulting, I've done a lot of auditing. I'm now a minority shareholder in an auditing company. So I'm actually really at the coal face of working with Jazance and all the bodies who look after it. So I know there are a lot of enthusiastic hands when I said who likes to be audited. Let me give you some thoughts that might help you when you're choosing an auditing body. Why do we have compliance? Compliance gives us feedback, we as an industry, on how we're going. What's the satisfaction of our end users with the product that we offer them? Care, support, and everything that goes with it. So many people that I've spoken to find compliance a chore. And yep, it's another job that's got to be done. But it's the best way for you to understand, how's my business doing? Am I hitting the targets with satisfaction? Am I hitting the targets to be able to say hand on heart, I'm doing the best job that I possibly can? And compliance is one way of getting through it. When you're going through an audit, don't be embarrassed if you get non-conformances, major or minor. What do you do with them? You use them as a tool to learn. They're not black marks against you personally. It's about your processes and were not working well enough at that time. I first met Bobby when a colleague of mine did an audit for him, and Bobby had half a dozen or more major non-conformances. What did Bobby do with that? Created a new business by reconstructing his business based on the guidelines that were given through the non-conformances. And Bobby's told the story, so I'm sure it's not embarrassing to him. When you select an audit company, there's about 16 currently that I know of. Everybody says, I want the cheapest product. And you know what? If you buy cheap and nasty, that's what you'll get. We're not cheap and nasty. I'm not cheap at all. But if you buy cheap and nasty, you get what you pay for. You get auditors who may be in Pakistan, Singapore, anywhere but in Australia. That's against the Jazz-Ants rules for a start, but that's a different discussion. They've not worked in the industry. They're not necessarily understanding the standards. I was engaged by a lady a couple of months ago who got 32 major non-conformances in her audit. She was just about suicidal. When I had a look at her audit report, probably 3 of them were worth a major non-conformance. The rest were on the basis that the auditor hadn't really read the policies. And it's really hard to do an audit if you haven't read someone's policies. The audit was conducted by phone, and they did it in 2 hours. It was a really cheap audit, but that's what she got for it. So when you're choosing an audit company, ask them how they do the audits. Do your auditors have industry experience? Are they trained in NDIS? And if they give you vague answers on those, back to the yellow pages, because they're not worth your money. What do you get from it? You get a report. End of the day, what is it you pay for when you engage an audit company? You pay for the report, because the report is what goes to the commission, and the report is what a smart provider uses to improve their business. I've seen some of the cheap and nasty reports. They're barely literate. You're not going to learn anything from them. So make those considerations. Think of it as the price of doing business, not how I can get something really cheaply. What to preparing for an audit? Again, there's no one size fits all, but it really is important in preparing for an audit to have read through your policies, have your registers up to date, feel confident with everything you're doing, making sure the staff really understand the training you've given them and all the support that you hopefully give them. Let me give you an example. I was auditing a provider in Queensland who presented a long list of things they did at staff induction, and it looked really impressive. I started to interview some of their staff, and the disability support workforce predominantly were born somewhere offshore. These support workers were really fantastic people, but they didn't understand what the word induction meant. So when I said induction, I got blank stares. When we talked about breaking down what they received at induction, they'd received it plus quite a bit more. So it's being able to really understand and dig down. I actually say to my clients now, when you're preparing for audit, remind your support workers that this and this is induction. This is the document you use if you're doing an initial assessment, a participant intake details, formalising so that they understand what they're doing, because whilst I've talked about providers being well briefed, you also want your support staff to be equally as well briefed, because they're usually very proud of what they do. They usually do a really good job, and they want to be able to present themselves as well as possible. What to expect at audit? If you have an audit where at the end of the day you feel like you've failed, you feel like you've been abused, you feel like you've been made to feel like a third-rate citizen, the problem's not yours, the problem's the auditing companies. because any auditor who goes in there and makes the client or the participants or the staff feel bad about what they do has failed. Because this is about looking at the processes. If your organisation's got some non-conformances, it's because the processes are not right. It's not because the owners and staff set out to do the wrong thing. In a long career, I've only met very few people who set out to do things that aren't correct. But so you really want the auditors to work with you. One of the best ways of having that is when you're asked for your documents, send them everything plus the kitchen sink, because then they can see how transparent you are, and nothing is worse on audit day than saying, oh, can I have a look at this, can I have a look at that, which is really core documentation. Send them the biggest JPEG you can find with everything on it. If they haven't read it by then, that's their problem. You'll find conscientious auditors will have had a good read and turn up well briefed to work with you. Utilising your report, use it as a quality exercise. You've paid a lot of money for it. Even with the cheap and nasties, you've paid a lot of money. So utilise the report to think, what can I do better? How do I use this as the stepping stone to improvement, regardless of what's in your report? But use it in a very positive light. Don't just file it under R for report, but use it as a document at your management meetings, your staff meetings, to look at what could we do better. High quality audit companies. I said there's 16. These are the only 3 I deal with. I'm a co-owner of the first one, so I guess I've got a bias. These other 2, I know them well, and they do honourable work with experienced auditors and do good reports. Any questions, please? Sorry? Oh, yeah, this one. I'll just cover these ones up. Yes, sir.
Thanks for a very informative presentation on the auditing process. I guess some of the things that I have taken away from that is, if your internal audit regime is strong enough, then I guess there is no need for any non-conformances, or you'll be right for some of the audit. Doesn't matter who comes to it. Then kind of your take on, you talked about compliance audit. So we are moving a little bit away into performance audit. So do you have any views of compliance and performance audit?
I'll just make a comment to your first point, if I may, that if you have a robust internal audit system, you should be sitting quite comfortably at audit. On the other side of that, I've been into organisations that have a good internal audit system, but some of the people I talk to still don't understand some of the processes. Some of the participants are excluded from giving input into some of those processes. I think the next generation of NDIS change, and the current minister's already started to talk about a greater emphasis on the participant experience, which is where it starts to become more a performance type audit. I think that's personally a really good thing, because at the end of the day, our job as providers is to work with the people who are receiving the services to enhance their quality of life. If we don't engage with them and ask, are we doing it right, or what can we do better, then we're not going to know. So I think there's going to be a shift away from the sort of hardcore compliance, non-compliance. It'll still be there, but it'll be wrapped very much around the participant experience. And the participant experience includes their support network and anyone who's in that participant's life. Does that answer your question? Thank you. Yes, ma'am.
Auditor that I had forgot to lodge the good 18 months, and when the audit come around again, and I contacted them, they said, oh, we just forgot to lodge it. And so that's my question is, I've only used the one audit. If I changed company, what pros and cons would be to that?
Very good question, thank you. Firstly, an audit, when your audit's completed, the audit company should send you a draft report to read and sign off on that you're in agreement with it. The JASANS rules, which are the rules all the auditing bodies have to live by, is that within 28 days of the audit being done, your report has to be lodged on the Commission's website. Good plan. There's now much better surveillance of that by the Commission, and one can never say that it's okay not to lodge the documents, because it's not. In the case of changing audit companies, as participants have choice and control, so do providers. The choice and control is very much around which auditing body do I want to use. If you've got an auditing body that meets your needs, listens to you, works with you, why would you change? But if they're not working with you and giving you satisfaction and value for your investment with them, then there are other people to try.
What's the pros and cons of it?
The pros and cons?
Yeah, so I've been with one auditor, so they know my service, they know what we do, they know my policies, my procedures, all that. Then is that like starting again?
No. It would be a straightforward matter if you change to company X from Y, that you would submit your policies at the due time, they'd be read, the auditor would hit the ground running with you. There is an advantage of actually changing companies, regardless of who you choose, because if you get an auditor shouldn't do an audit for one company more than 3 times, or else you've got the familiarity issue where she'll be right, I know they're working on it. Well, that's not good enough. You're entitled to the best evidence of how your company's performing from a compliance perspective, and a new set of eyes, fresh set of eyes, can deliver that to you. Thank you very much.